Hopefully you know where you are. This is a Spinal Cord Injury BC SCI forum event on weight management. Welcome and thank you for spending your morning with us. I'm Jocelyn Maffin. I work with Spinal Cord Injury BC. My colleague Terry, who organized this event, is behind the scenes, letting people in and offering a little bit of support for anyone who's not been able to get in to the Zoom session. I didn't mention it yesterday, but I should have. This forum is part of our Vancouver peer support program and our Reach Out online peer support program, and which is funded in part by Vancouver Coastal Health. Just to remind everyone, we came to this topic through a clinician who raised to us the problem of having few SCI aware resources in the community to support people who are learning about weight management and needing to manage their weight, living with spinal cord injury. And we are learning how we can best support our peer community along that topic. And our session here today has some common values, and those are sharing tips and experiences that everyone has something to offer and something to learn, acceptance, mutual support, respect, and learning. And we welcome you to interact at our Q&A by raising your hand, which is the hand raising function like that, and or put your question or comment in the chat and we can read it for you at the appropriate time. But I'm going to jump right into introducing our first speakers. Today's topics are nutrition and high quality weight loss after SCI with Joanne Smith and David. How do I say your name, David? Ditor. Thank you. And the session after that is on medical weight loss treatments and with a peer lived experience panel at the end. And I'd like to introduce our speakers. Joanne Smith is a certified nutrition practitioner who graduated with first-class honors from the Institute of Holistic Nutrition in Toronto. She holds a degree in psychology from York U, as well as a diploma in radio and television broadcasting. I think you also may have seen her in AMI shows. So her nutrition services focus on individuals who have sustained traumatic injury with specialization in neurological conditions such as SCI and brain injury, multiple sclerosis, and cerebral palsy. Joanne co-authored Eat Well, Live Well with Spinal Cord Injury and Other Neurological Conditions, the first nutrition book dedicated to addressing the unique needs of people with SCI. She's also a regular nutrition columnist for New Mobility and community magazines in Canada and the USA, and teaches nutrition classes to individuals who are deafblind at the Canadian Helen Keller Center. David Ditor is a professor in the Department of Kinesiology at Brock University. His research program focuses on the secondary health complications that accompany spinal cord injury. More specifically, Dr. Ditor's research interests involve chronic inflammation after SCI and the associated range of negative effects, the cardiovascular disease and dysfunction after SCI, and sexual dysfunction after SCI. And some of these health complications are modifiable, Dr. Ditor is also interested in the role of exercise and diet in managing and reversing them. In addition to his teaching and research responsibilities at Brock, Dr. Ditor is also the founder and director of PowerCord, an accessible facility that provides specialized and supervised exercise for individuals with SCI, MS, and lower limb amputations. I just want to welcome you both and thank you for spending your Sundays with us, or Saturdays, and invite you to start your presentation.
Great, thank you, Jocelyn. So we're just going to get the presentation up. Okay. So thank you for having us. This is a great opportunity to share our knowledge and experience because it's such a well-needed topic. So Dave and I, as Jocelyn said, will be covering nutrition and high quality weight loss after SCI. Weight management for me, my nutrition practice is really spinal cord and brain injuries. And this is one of the top issues that I deal with is weight loss. So what we'll be covering today on our agenda slide is why nutrition is important after spinal cord injury. If we can hit the next slide there, Dave. There we go. Thanks. So why nutrition is important after SCI, some very specific SCI facts around weight and nutrition, common nutrient deficiencies that people with SCI experience, benefits of nutrition specific to SCI, and then we're going to go over specific weight guidelines for people with SCI, the role inflammation plays in weight loss and overall health for people with SCI, and then specific food and supplement recommendations. Okay, so some SCI facts. People with SCI commonly experience poor diets. Studies show this for several reasons, such as change in economic status. We tend to have poorer diets, lack of transportation just to get out and buy healthy foods, also decreased function, mobility, dexterity to prepare healthy meals on a regular basis is a contributing factor to weight gain, and also just poor nutrient status can affect our metabolism. And looking at common nutrient deficiencies that people with SCI tend to experience, and again, studies show this, we tend to be deficient in vitamin A, vitamins B2, B9, B12, vitamin D, vitamin E, calcium, chromium, magnesium, zinc, and fiber. And a lot of these do have a lot to do with weight management, which we will be going through. So this is just good knowledge to have. So you know what foods you should be eating to get more of these nutrients because we tend to be deficient in them. And when we're deficient in these nutrients, it can contribute also to the development of many common, recurring, and potentially life-threatening secondary health complications. So on top of your initial, whether paraplegia, quadriplegia, studies show that the average person living in the community experiences 7 secondary health complications a year. It could be any of these that are listed and others. So things like digestive dysfunction, constipation, bowel obstruction, loose stool, chronic UTIs, obesity, weight gain, pressure sores, osteoporosis, arthritis, type 2 diabetes, heart disease, neuropathic or muscular pain, and sleep disorders are just some of the secondary complications that we experience each year. And these secondary health complications in turn place additional demands on our body for nutrients. So the fact that we tend to be nutrient deficient in those vitamins and minerals that I listed, plus we're at risk for these secondary health complications, it is critical that we maintain a healthy diet as well as maintain a healthy weight for our long-term health. So the benefits of good nutrition, eating well for anybody with an SCI is that it can actually help improve your sleep, which can help then increase your energy levels throughout the day. It can help reduce the risk and help heal pressure sores if you've ever had those. It just maintain good skin integrity. It can help you maintain bone density. We know we're at high risk of osteoporosis, osteopenia, and also good nutrition can help reduce pain by reducing inflammation, which Dave is going to go into great detail very soon about. It can also help improve your mood. Believe it or not, food has a huge impact on your overall mood. And it can also, things like fiber, improve bowel routines, make them more efficient, effective, and manageable. Can help reduce the risk and occurrence of any kind of infection, whether it be through a pressure sore, urinary tract infection. And studies do show that we actually have nutrient needs above recommended daily allowances that are able-bodied counterparts. So we need higher quality, higher dosages of nutrients. And a lot of us are on medications, which is absolutely necessary, but some of these medications can actually deplete nutrients from our system. So again, eating healthy can help maintain our status of our nutrient levels. And of course, what we're talking about here today, it can help maintain an ideal weight. Okay, so let's get into the specifics of spinal cord injury, nutrition, and weight loss. Now, I do want to say, I will be talking about some supplements here. So please, before starting any supplement recommendations I may go over today, always consult with your physician or healthcare provider, because there can be interactions with some of the new supplements I'm recommending today and medications. So always check with your healthcare provider first. Okay, so let's get started here. Spinal cord injury and weight gain. It is, as I was saying, one of the most common secondary health complications. It's definitely one of the biggest ones that I work with my clients. And studies show that 65% of people with SCI are overweight, with 1/3 of these being obese. And body fat percentage is 8 to 18% higher in people with spinal cord injuries, which is significant. And the reason that we are at high risk of weight gain after injury, again, many different reasons, but there is a change in body composition. We lose lean muscle mass. That's one big reason. We also have lower metabolic rate. Our metabolic rate drops by about 14 to 27%, which is huge. Medications, a lot of pain medications can contribute to weight gain. Obviously, reduced physical activity. We just can't get our muscles moving the same way as we used to. Again, poor diets can contribute to weight gain. A lot of people that I work with, I notice they tend to be eating the same portion size as they were pre-injury, which doesn't work once you're in a chair. And again, the nutrient deficiencies can contribute to weight gain. Change in economic status post-injury can impact our ability to buy healthy foods. Hormonal changes take place after injury, which can affect weight gain as well. Again, inflammation is a big one that Dave's going to be talking about shortly. We also have glucose intolerance and poor carbohydrate metabolism, as well as we tend to be more insulin resistant. So all of these together contribute to weight gain, which is why it's just so easy to put those pounds on after injury. So factors that are associated with excess weight are numerous as well. When you're overweight, you put extra stress on your joints, particularly things like your shoulders, pushing your wheelchair around. It also can decrease circulation, which we already have decreased circulation because of our paralysis. Again, fat cells actually contribute to inflammation, which Dave is going to be talking about, and how that can be detrimental to our overall health. And weight gain can contribute to fatigue, which is a big issue after injury. It can also compromise our bowel and bladder routines. It can contribute to poor sleep, depression, insulin resistance, type 2 diabetes. Fatty liver is a big one. Again, it can contribute to and exacerbate hormonal imbalances, difficulty breathing, increased risk of blood clotting, reduced life expectancy, stress on the kidneys, reduced immune function, and increased risk of pressure sores. So this is, you can see, there are multiple reasons why we really need to try and maintain a healthy weight post-injury. Now, there are ideal recommended calorie calculations for people with SCI. And just, this is really important to look at. So for paraplegics, what is recommended through studies is that you eat 28 calories per kilogram of ideal body weight. So just for an example, if you're 150 pounds, to convert that into kilograms, divide by 2.2. So 150 pounds is 68 kilograms. 68 kilograms times 28 calories comes out to 1904 calories a day. That's for paraplegic. For quadriplegic, it's recommended that you eat 23 calories per kilogram of ideal body weight. So same calculation here, 150 pounds, 68 kilograms times 23 calories comes out to 50 and 64 calories a day. So this is less than your able-bodied counterparts. Now, in terms of knowing what your ideal body weight should be, so you can do these calculations, here is an ideal chart for your ideal weight. So this is what you're looking at. If you are a paraplegic male, what you want to do is calculate 110 pounds for your first 5 feet, and then 5 pounds for every inch over and above that. And then you minus 5 to 10%. That is your ideal body weight range. For females, it's 100 pounds for the first 5 feet, and then 5 pounds for every inch after that. And then again, minus 5 to 10%. For quadriplegia, you're doing the same calculations for male and female, but you're then reducing 10 to 15% for your ideal body weight range. And then you can do the calculations for the calories. So It might sound complicated, and I know I'm going through this kind of quickly because we have lots of information to cover here, but this is recorded. So please go back and refer to this to calculate your ideal body weight and calorie consumption daily needs. Okay, and just for BMI, I often get asked about BMI. There's also been studies that look at BMI numbers, and we're not the same BMI numbers as our able-bodied counterparts. So please refer to this chart as well for BMI to see where you sit if you're in a healthy range. Okay, so I know that's a lot of kind of calculations there. And I've also given you here a serving size comparison chart. It is often difficult to count calories. I've just given you some calories, but day to day, counting calories can be tedious and tiring. So when I'm working with my clients, I tend to give them serving sizes, like how many servings of protein, carbs, vegetables they should be eating a day. So this is a chart for you again that you can refer to after the presentation, refer to it so you can see how, when I talk about how many serving sizes a day, this is the chart that I'm referring to. So you can go back and consult with this. Okay, so let's get into some specific nutrient recommendations for weight loss. And the big one, the first one here is reduce your grains. Studies show that individuals with SCI have significantly reduced metabolism. Remember, I said 14 to 27% our metabolism drops. We tend to have glucose intolerance and poor carbohydrate metabolism, which basically means we do not metabolize our grains well. So once grains, so whether it's bread, pasta, or rice, once it's in our stomachs and it's digested, it turns to glucose. Glucose is basically sugar. So if we have poor reduced metabolism and glucose intolerance, we're not going to metabolize carbohydrates well, so you need to reduce them. This is one of the biggest contributing factors to weight gain for our population. So you really want to focus on healthy grain sources. And what I mean by that is whole grain bread, whole grain pasta, or brown rice. And the reason for that is it has fiber in it. Fiber slows the release of glucose, sugar, into our bloodstream. And that is one of the biggest contributing factors to maintaining a healthy weight. So not only do I want you guys converting to healthy versions of your grains, all the whole grain ones, I also want you really limiting them. So that would be like one slice of whole grain bread or toast, or a half cup of brown rice, or a half cup of whole grain pasta. That's it. This is the biggest one and the most difficult one for people because carbohydrates, grains are comfort foods for us, especially after injury, but you really need to reduce these. Okay, so that's the guidelines for how much to eat a day. And people always look at me and go, what am I going to eat? I'm going to starve. Trust me, you won't. What you want to do is replace your grains with legumes and lentils. These are also carbohydrates, but they're healthier versions of them because lentils, legumes have protein in them, lots of fiber, as well as vitamins and minerals. And that fiber is going to slow the release of the glucose into your bloodstream and help maintain a healthy weight. So when I talk about legumes and lentils, it's things like black beans, chickpeas, hummus. So whether you have that in a chickpea salad or a chili, you want to have 1 to 2 servings a day. Again, go back to the chart that I just posted a few slides ago. So if you're having 1 serving of grain, couple servings of lentils, legumes, that's already right there quite a bit of food. And trust me, you'll be full with all that fiber. Okay, so the next thing you want to do, and this is a really big one, balance your blood sugar levels. So weight loss is about what you eat, healthy versions of foods like I just talked about, how much you eat, and I'm giving you specific serving sizes. The third element that's often not considered with weight loss is balancing your blood sugar and hormone levels. And what I mean by that is blood sugar affects your insulin. Insulin is a hormone. When your blood sugar levels go up and down all day long, your insulin's going up and down all day long. And that is what contributes to weight gain as well. So you want to balance your blood sugar. When you have balanced blood sugar, you have balanced insulin levels, and that can help with the weight loss process as well as maintaining a healthy weight. And if you look at this chart, you can see what I'm talking about between blood sugars and insulin here. How do you balance blood sugar levels? Here's 2 big tips. Number 1, eat protein for breakfast. So if we can go to the next slide, please, Dave. When you eat protein for breakfast, and when I mean protein for breakfast, I mean things like Greek yogurt or regular yogurt, eggs, protein smoothies, even leftover chicken, beef from the night before, if you want a really hearty breakfast. Studies show that people who eat protein for breakfast, it helps stabilize your blood sugar levels for the rest of the day. If you eat, say, a bagel or toast or cereal for breakfast, you skyrocket your blood sugars, which means you're going to skyrocket your insulin. What goes up must come down. And that starts that blood sugar imbalance, the up and down all day long. Protein for breakfast is one of the biggest things you can do to help balance your blood sugar levels. Okay. The next thing you want to do to help balance your blood sugar levels is get rid of refined processed sugar. It is nasty, and Dave's going to talk about sugar and inflammation a little bit later, but just cut out the refined stuff. If you can cut out pop, candy, cookies, processed refined cereals, which are loaded with sugar, it will really help stabilize your blood sugar levels. And just for an example, the World Health Organization recommends that women eat no more than 6 teaspoons of sugar a day, processed sugar, and men eat no more than 9 teaspoons of sugar a day. When you look at, say, a sport drink or a can of pop, a lot of these drinks contain 42 grams of sugar, which is equivalent to about 10 teaspoons of sugar in one drink. So for a lot of people, they are consuming 4 or 5 times this amount every day, which is going to skyrocket your blood sugars. And again, what goes up must come down, and you get that up and down motion all day long, your blood sugars. That is going to contribute to weight gain. So cut out the processed refined sugar. I cannot say enough of this. So that's really going to help balance your blood sugar levels. Okay. The next thing I want you to do if you're looking to lose weight is reduce your fruit consumption. I work with people, and sometimes they're eating 5, 6 servings of fruit a day, and they want to lose weight and they think they're doing a really healthy thing. So not that fruits are bad. Fruits do contain fiber and fructose, which is a natural sugar. But if you're eating 5 or 6 servings, it's still way too much sugar. So for us with SCI, 1 serving of low glycemic, low sugar fruit a day. So things like berries, pears, apples, avocado, nectarines have lower sugar contents. And if you have 1 cup of berries or 1 apple or 1 pear a day, that is your 1 fruit serving for the day. Try and avoid high glycemic, high sugar fruits like bananas, papaya, pineapple, mango, grapes, even dried fruits are very concentrated in sugars. So you'll still be getting good nutrients and good fiber with the one serving of fruit, but you're going to then load up on your vegetables, okay, to get more nutrients and more fiber without as much sugar. So increase your vegetable intake. Again, loaded with fiber to help slow the release of glucose into your bloodstream. And if you can get 5 or more servings of vegetables a day, that is going to be ideal. Again, it's going to fill you up. You will not be hungry. You're going to get lots of good nutrients and help balance your blood sugar levels. And basically a serving is about the size of your hand. So it sounds like a lot, but if you had 3 handfuls of, say, spinach for lunch in a salad with a piece of, I don't know, tuna or chicken on top, and then had 2 more servings, 2 handfuls of broccoli or cauliflower for dinner, there's your 5 servings right there. So it's really not that hard to get it in your daily diet. Okay, the next thing that I really recommend is increase your healthy fats. When I talk about healthy fats, I mean omega-3s. So omega-3s, Dave's going to talk about quite a bit shortly. And they help reduce inflammation. Reducing inflammation can really help with the weight loss process. So things like salmon, tuna, halibut, walnuts have lots of good omega-3s in there. And you want to be eating fish 3 to 4 times a week. Snack on some walnuts or even some almonds in there and get the healthy proteins, healthy fats, healthy fiber in your diet every day. But reduce the bad fats, the trans fats are in the fast foods. Increase your healthy fats. Okay, so those are all of my food recommendations. For weight loss, I have 2 big supplement recommendations. And the first one is to introduce chromium. Chromium is a micromineral. It's in our soil, And when our fruits and vegetables grow, they absorb the chromium from the soil. Then we eat the fruits and veg, we get the chromium in our system. The reason chromium is important is it helps our cells become more sensitive to insulin to get the sugar in our blood into our cells. So it's burned as a fuel as opposed to being stored as fat. Now, unfortunately, most people aren't eating enough fruits and vegetables, but also with our monocropping process, how we actually grow our fruits and vegetables these days, we're just not getting enough. We're not getting the same amount of chromium in our fruits and veg that we say our grandparents did. So most people walking and rolling around out there are chromium deficient. So you can actually get this micromineral chromium in a supplement form. And supplement dose here, you can see it's 200 to 400 mcgs a day. You can go higher if you're pre-diabetic, as shown through your blood work. But this is really important. Any weight loss program where there's a secret ingredient, whether it's in a drink or a pill form, it's chromium. Chromium is the secret there. This, though, if you are pre-diabetic or diabetic and you're on any kind of medication, do not take chromium. This is one of the cancer interactions I was talking about. Always check with your physician first. But if you're not on any kind of like diabetic medication, you might want to consider taking chromium. And the next supplement that I recommend is healthy fats. So again, I said to have those omega-3s through fish, eating 3 or 4 times a week. But if you want to actually like up it a little bit, if you're not eating that fish, or you want to ensure you're getting your omega-3s every single day for that anti-inflammatory effect, then I would take specifically a CLA for weight loss healthy fat supplement. There's different types of molecules of different types of fats. There's GLA, CLA, EPA, DHA. CLA specifically can help with trunk fat, abdominal fat. And what you would be looking at taking is 3,000 to 4,000 milligrams a day. These come in 1,000 milligram pills. So you're taking at least 3 to 4 a day. Again, please check with your health professional first if you're on any blood thinning medications, because healthy fats do have a natural blood thinning property to them. So please check with your health physician first. And yeah, those are my nutrition recommendations. And now Dave's going to go into some much more specifics of what I was talking about. So I'm going to pass it over to you now, Dave.
Okay, thanks very much, Joanne. And again, thanks for inviting me to this talk today. I'm always thrilled to share our results that we found in our lab. I've known Joanne for quite a number of years now, and we've actually put her diets to the test. So not only does she have clinical evidence that they're highly effective, but as I'll show you in my talk today, we've got real published data showing that not only do these diets actually lower inflammation, but they have other health benefits as well. So what I'm going to talk about today, though, is about high quality weight loss after spinal cord injury, and is this possible? And what high quality weight loss refers to is the ability to lose fat with a low calorie diet, but importantly, at the same time, maintaining muscle mass or even gaining muscle mass. This is a tricky thing to do, and I'm going to discuss how it can be done and if it's possible after spinal cord injury. So really the question I'm going to try to answer is, can lean mass be preserved while fighting obesity in people with spinal cord injury? And before I really start answering this question, I'm going to give you a little bit of a background as to how I came to be interested in this work in my lab. So several years ago, I became very interested in the ability for diet or nutrition as a means to manage many of the health complications after spinal cord injury. And I was particularly interested in, can diet affect inflammation in such a way as to lower inflammation, which may then carry on to have many health benefits for people with spinal cord injury. So why is this an interesting topic? Why do we talk about inflammation when we talk about spinal cord injury? Well, unfortunately, people with spinal cord injury are characterized by chronic inflammation, meaning if you took a blood sample from someone with spinal cord injury at virtually any time, it would have about 3 to 5 times the inflammatory mediators in circulation compared to the able-bodied population. Why is this? Well, people with spinal cord injury, as we know, are susceptible to infection after infection after infection. Joanne mentioned all the health complications that people run into after spinal cord injury. So UTIs, pressure sores, respiratory infections. These infections can have a cumulative effect and lead to a state of chronic inflammation. Also, there's a higher risk, of course, of obesity and cardiometabolic disease after spinal cord injury. And these conditions are also pro-inflammatory. So that increases the risk as well for people with spinal cord injury. And what happens when we have chronic inflammation is these inflammatory cells that we call cytokines, they're always in circulation, and they can have a negative impact on a wide array of systems in the body. For example, cytokines can increase the likelihood of neuropathic pain. They can do this by sensitizing pain receptors in our body so that we get either spontaneous pain after spinal cord injury or a heightened pain in response to touch. Pain is very prevalent in people with spinal cord injury. About 69% of people with spinal cord injury report some kind of pain, and it can be quite severe, with 30% of people rating it as actually disabling. There's various different kinds of pain after spinal cord injury. Musculoskeletal pain is quite prevalent, often in the shoulders, for example, from transfers or wheelchair propulsion. But there's also neuropathic pain, which tends to be quite specific to people with spinal cord injury. It results from a hyperactivity of the pain pathways in the spinal cord. So, for example, the spinal thalamic tract, which carries pain sensations in the spinal cord, it becomes damaged. And then as a result, we can get, like I said, spontaneous feelings of sometimes severe pain, even when no one is touching the skin, or it could be, a heightened sensitivity to touch that can cause pain from, stimuli that wouldn't normally cause pain at all. Neuropathic pain is very difficult to treat after spinal cord injury. There are a couple of very commonly used medications. They're not effective for everyone. They don't bring pain down to zero, and they also come with some nasty side effects. So there is a real need to find other ways, other means to try to reduce neuropathic pain. And as I said before, this is highly common in people with spinal cord injury. There was a study done that took a large number of people with both traumatic and non-traumatic spinal cord injury. They surveyed all these people to see how often they experienced about 20 different health complications, as you can see listed here on the x-axis. And it was shown that for both people with traumatic and non-traumatic spinal cord injury, the presence of neuropathic pain was one of the most common problems in this population. You can see here the reporting between about 55 and 65% of people experience neuropathic pain. So it's difficult to treat and highly common in people with spinal cord injury. Inflammation, I said, can increase neuropathic pain. It can also increase the risk of depression. And that's because these cytokines interfere with the production of serotonin in the brain and the way that we can use serotonin in the brain. And that's because these cytokines interfere with a pathway called the kynurenine pathway. That pathway is responsible for taking tryptophan in the brain and turning it into our happy neurotransmitter, which is serotonin. And these cytokines can interfere with that pathway and increase the likelihood of depression. Depression is very difficult to generalize after spinal cord injury. Of course, not everyone suffers from depression, but there is an increased risk. There's about a 42% overall rate of depression after spinal cord injury, with about 21% of people reporting major depression. And this is about 4 times greater than what we see in the able-bodied population. And also, very sadly, suicide rates are higher among people with spinal cord injury as compared to the able-bodied population as well. So as a result, what we studied in my lab, we really wanted to lower inflammation in people with spinal cord injury and see what the many health benefits could be. I was in touch with Joanne. I was very interested to see if her diets in particular could lower inflammation, and would that have a positive effect on neuropathic pain and depression as well. And you can see we've published these studies. And a bit of a spoiler, of course, yes, these diets do lower inflammation and have a positive effect on neuropathic pain and depression. The diet itself, I won't go over this in too much detail. Joanne already talked about it, but the diet really does eliminate any pro-inflammatory foods. So we're eliminating refined sugars, anything with a high glycemic index. Cow's milk, many people are intolerant to cow's milk, even mildly and asymptomatically, but so that's eliminated. We eliminated hydrogenated oils and fried foods, and we almost completely eliminated alcohol and coffee. In this study, people were allowed to have a maximum of 2 bottles of beer per week, but that's the only amount of alcohol that could be consumed. Joanne also mentioned the benefits of supplements. So in addition to eliminating these pro-inflammatory foods, we had these people take daily supplements. Like Joanne mentioned, the benefits of omega-3, so they supplemented with that daily. Chlorella, which is a form of algae, which is shown to be anti-inflammatory. They took supplements with a battery of different antioxidants. Curcumin was something that was supplemented as well. And every day started off with a protein for breakfast in the form of a veggie-based protein powder shake. This is a snapshot of the 1-week meal plan. You can see that there's breakfast, snack, lunch, snack, dinner. So everyone in the study was required to actually follow this diet as closely as possible. You can see that every morning started off with that protein shake, with that protein powder. And you'll notice, like Joanne said, this is not a vegetarian diet, but any animal protein really was either lean poultry or oily fish like salmon, like Joanne mentioned. So this wasn't really supposed to be a calorie restricted diet. The purpose really was to eliminate pro-inflammatory foods and promote anti-inflammatory foods and supplements. People were also given an extensive list of foods that they could eat and foods they should avoid. So if they wanted to make any substitutions to the meal plan I just showed you, they could make these substitutions. This was an extensive list. I'm just showing you 1 page of this. But as you can see, they could make substitutions as needed. And many of our participants actually did do that over the 12-week study. So what were the results in this study? So first of all, it's important to mention, this isn't just lip service. We took blood samples, and this diet did prove to actually be anti-inflammatory. We took blood samples before and after 12 weeks of being on this diet, and we found a 28% decrease in these pro-inflammatory mediators that were in circulation. And specifically, as you can see, we found specific decreases in cytokines such as IL-2, IL-6, IL-1 beta, and interferon gamma. It was also really nice to see that we had a really big reduction in neuropathic pain. We had a 40% reduction in neuropathic pain as measured by the neuropathic pain questionnaire. This 40% reduction, I don't want to minimize it. It's basically the exact same ballpark that you see when people go on these medications I mentioned before, like pregabalin and gabapentin. You do get about when they're successful, about a 40 to 50% decrease in neuropathic pain. So our diet was really, not only did it lower inflammation, it was right in the ballpark of reducing neuropathic pain as effectively as first-line medications that are recommended today. We also found an even bigger drop in depression. We had a 55% decrease in depression as based on the CESD questionnaire. And again, our blood work showed that these decreases in depression really were related to that kynurenine pathway. So we really have evidence that this diet was in fact enhancing the ability for the body to produce and use serotonin. Now, we did a follow-up study 1 year later to see if people were still eating this way 1 year after the study had completed. And just to tell you, the results we found during the study, when people were in that 12-week study, they had a compliance of that diet of about 89%. It was really very well adhered to. 1 year later, we found, kind of surprisingly, the compliance of the diet dropped to 43%. Despite all these benefits that we found in pain and depression, 1 year later, people simply weren't eating the way they used to be. We found this kind of surprising. And so we did yet one more study, a qualitative study, to interview people to find out, why aren't you still eating this anti-inflammatory diet? What are the barriers? What's getting in your way of still eating this anti-inflammatory diet? And what are some facilitators? What were things that you find allow you to keep eating this way for the small changes that you've made? And we found a few kind of common barriers. One was the expense of the supplements. They could get a bit pricey. In terms of facilitators, we found that people reported if they were allowed to cheat once in a while in the diet, they really found that helped their long-term compliance. And also, this was interesting, they also reported that they were happy that they had lost quite a bit of weight on this diet. Now, we didn't formally measure that, but a lot of people had lost anywhere between 15 to 25, 30 pounds within 12 weeks of being on this diet. And that they found that encouraging. So what we did with these kind of results is we created a new diet that we called the Mad Dog diet. It was 5 days a week instead of 7, because people said that cheating once in a while helped them for long-term compliance. We also got rid of the supplements and tried as best we could to replace all that nutrition with actual real food instead of relying on supplements. And again, this wasn't designed to be a low-calorie diet, but after we analyzed all the food logs, we found that people were eating just under 1,400 calories per day on average, and it was around 250 to 500 calories per day less than what would be considered required for weight management for them. So this actually did kind of turn out to be a calorie-reduced diet. We again wanted to see, did this new diet, this modified anti-inflammatory diet, did it still lower inflammation? And this time we did want to formally measure weight, what was happening to fat mass and what was happening to muscle mass. And like I said before, ideally we want to see decreases in fat mass while maintaining lean mass, but that's a tricky thing to do. So we had 6 people in that study with either spinal cord injury or MS, and everyone was at least 1 year post-injury or post-diagnosis. The compliance in that study in terms of the results, again, everyone completed, this time it was a 6-week diet with an average compliance of 92%. So people really did stick to this Mad Dog diet very, very well. Again, we did show this time by taking saliva samples, we did show decreases in inflammation with a 34% decrease in C-reactive protein. So that was very encouraging. This is in fact an anti-inflammatory diet. And here we found, yes, they did lose weight. They did have a reduction in fat mass of about 3 kilograms. Total mass of about 3 kilograms, a significant decrease in fat mass of almost 2 kilograms in 6 weeks, with significant decreases in subcutaneous fat. But unfortunately, we also found a significant decrease in muscle mass in this study of about 1 kilogram of muscle mass over 6 weeks. So there was some bittersweet results with this study. It was effective in lowering inflammation. That's great. It was effective in lowering fat mass, but unfortunately, we also found decreases in lean mass. Now, this is a bit unfortunate, but it's certainly not unusual when we talk about hypoenergetic or low-calorie diets. In fact, there's been a systematic review in able-bodied people, and it looks like losses in lean body mass account for almost 20 to 30% of losses in total body mass during low-calorie diets. So that means when we go on weight loss diets, we do lose body weight, but about 20 to 30% of that loss in body weight commonly comes from losses in lean mass. And we really don't want to do that. We want to lose fat mass while maintaining lean mass whenever we go on any kind of diet. And that's what we mean when we talk about high quality weight loss. So we're going to talk about high quality weight loss and is it possible to achieve this in people with spinal cord injury? First, let's take a look at the evidence in able-bodied people. How can we achieve high quality weight loss? And what you'll see, there's usually 2 strategies that people adopt when we're trying to do this. So when people are on low calorie diets, but they want to maintain lean mass, they either or both pair that weight loss diet with resistance training or make sure that that weight loss diet has a high amount of protein. And Joanne mentioned the importance of that high protein when trying to effectively lose weight. So here's one kind of very important study in this area looking at high quality weight loss and can it be achieved in able-bodied people by manipulating protein and resistance training. So in this study, they had 40 overweight men. They're on a low calorie diet. It was a quite low calorie diet with a 40% reduction in calories. all participants in this study, I want to mention, all participants were doing resistance training and high intensity interval training for 4 weeks. So everyone was on the diet and everyone was doing resistance training. But half of the participants were in a low protein group and half the participants were in a high protein group. And I'll just walk you through what this graph shows. If you look at the 2 bars on the far left, both groups did lose body mass. So there was a reduction in weight, as you'd expect with this low calorie diet. If you look to the far right, both groups did lose fat mass. That's also as you'd expect and exactly what you want. You want to lose fat mass with this low calorie diet. The middle bars are also interesting. Remember that everyone in this study was engaging in resistance training and HIIT training. And both groups, not only did they maintain their muscle mass, and you can see that in the low protein group, they simply maintained muscle mass, but the high protein group even increased their muscle mass. So what this shows is that if you're on a low calorie diet, resistance training alone, even all by itself, will maintain your lean mass. And if you double that by having a high protein diet as well, you'll actually gain lean mass. So this is proof that high quality weight loss can be achieved with these two kind of hacks, if you will. There's other studies that looked at high quality weight loss with just resistance training. There's a systematic review of 6 studies with obese older adults. The calorie restrictions in these studies were between 400 and 800 calories below recommended per day. And the resistance training was quite typical, 3 times a week, for example, for 12 to 24 weeks. And what you find in these groups of studies is that when you pair low calorie diets with resistance training, you can reduce the losses that we find in lean body mass almost completely by about 94%. The 2 bars that you can see down here, one on the far right, shows that if you're just doing a calorie restricted diet, that CR bar, you're going to get losses in fat mass, as you can see in the orange section of the bar, but also losses in lean mass. You don't want that. But when you've got calorie restriction with resistance training, as you can see on the left-hand bar, you really get just losses in fat mass. You pretty much eliminate completely the losses you get in lean mass, in muscle mass. And then last, you can look at just high protein intake itself when on a low calorie diet. Again, this is 15 randomized controlled trials that went into this review with calorie restriction of about 500 calories per day, less than required. And they had high protein here by adding about 2 to 4 servings of dairy or whey every day. And again, they found that increased dairy during low calorie diets resulted in greater losses in fat mass while attenuating losses in lean mass by about 75%. And they found that 2 grams per kilogram of your body weight per day of protein may be enough to maintain lean mass during a low calorie diet. So we're going to look now at the evidence. We know that high quality weight loss is possible in able-bodied people. We want to look, is there any evidence yet that we can actually achieve high quality weight loss in people with spinal cord injury? And we really can't assume that the answer is going to be automatically yes. Because of partial paralysis, we're not quite sure if people can resistance train intensely enough to attenuate the losses in lean mass while we're on a low calorie diet. And with changes in caloric requirements, which Joanne already mentioned, is it possible to really have that high level of protein while maintaining kind of these new energy requirements for people with spinal cord injury? So this is kind of a tricky question. Let's see what the evidence shows. But first, before we look at that, I'll just quickly go through what Joanne kind of already mentioned. That caloric requirements are highly variable after spinal cord injury. And when you're trying to calculate resting energy expenditure, ideally this is done by indirect calorimetry. So that's going to be a little bit difficult to do. The charts that Joanne showed you are really a good guideline for the caloric requirements that people with spinal cord injury should be taking. But if you are able to actually really get your energy expenditure tested, then you can multiply that by about 1.15 to determine really what is your total daily energy expenditure. What kind of studies have shown is that for people with paraplegia, like Joanne mentioned, you're looking at an energy expenditure of about 1,500 to 1,700 calories per day, meaning your total daily energy expenditure is going to be about 1,700 to 1,900 calories per day. But for people with tetraplegia, your resting energy expenditure could be as low as 900 calories per day, which means that your total daily energy expenditure is only about 1,000 calories per day. So if you want to maintain, energy in equals energy out, you really could be talking about quite low calorie diets. You can also look at protein requirements, and Joanne touched on this as well. But for people with spinal cord injury, you need about 0.8 to 1 gram per kilogram of body weight of protein intake, and that's in the absence of pressure sores. For people that do have pressure sores, they need a bit higher protein intake, about 1.2 to 2.0 grams per kilogram per day. And it's even greater protein requirements during acute spinal cord injury, where you probably need more than 2 grams per kilogram of body weight per day. So, let's just take a look. We've got now, just for example, we can take a look at how difficult would it actually be to get high quality weight loss after spinal cord injury if we really just required or relied on high protein diets alone. So let me just kind of run you through the numbers and show you why this might be a difficult proposition. If we take a look at someone with tetraplegia who weighs 75 kilograms and has a total daily energy expenditure of about 1,400 calories per day, this is not atypical at all. This is a very realistic example of someone who may have tetraplegia. If you were to put that person on a low calorie diet, you'd be asking that person to eat about 900 calories per day if that person was on a low calorie weight loss diet. If you were trying to get high quality weight loss with high protein alone, you could ask that person to eat about 2 grams of kilogram of protein per day. That would amount to about, because that person weighs 75 kilograms, about 150 grams of protein per day. That's about 600 calories of protein per day, which means you're asking that person to stay on a maintenance diet of about 67% protein. So it's not really realistic. That's an extremely high protein diet. It wouldn't be very palatable, and it'd be very, very difficult to actually adhere to. So my message here is that we really want to try to get high quality weight loss in people with spinal cord injury. And so if they're going to be on a low calorie diet, we certainly want to make sure they're eating high protein. That's going to be part of this, but it looks like we're probably also going to have to use that second trick and pair their low calorie diet with resistance training. So what's the evidence that we see so far for people with spinal cord injury? Well, here's one study that was done in 2006. They had 16 obese people with spinal cord injury. The BMI on average was quite high, of about 34. They were on a diet called the time calorie displacement diet for 12 weeks. It's very similar to the Mediterranean diet. And they also were asked to engage in exercise for 6 weeks. That exercise was supervised once per week, and it was just simply encouraged at home. So the study didn't really report on how frequently these people were actually exercising, and it wasn't really a formal exercise program, but exercise was encouraged as part of this. The results show that this was a low-calorie diet. Calories reduced by about 200 calories per day. They did find a significant reduction in weight and fat mass, which is encouraging. And they found no significant change in lean mass. So that's encouraging. And that shows that, when you paired this low calorie diet with exercise, that you did lose fat mass, but lean mass didn't significantly change. So perhaps it was actually maintained. Now, the protein really wasn't specified in this study. And like I said, the resistance training was recommended, but not really formalized. So it's still a little bit hard to draw firm conclusions from this study alone. Was this really high quality weight loss or not? But at least it's encouraging. Here's a study that showed that when we have a good amount of protein and ask people to engage in resistance training, that even though they're on a low calorie diet, they may be able to maintain their lean mass. There was another study that looked at 9 people with motor complete spinal cord injury for 12 weeks. They had 2 different groups. Both groups were on a formalized diet. One group was just the diet alone. The other group was the diet plus twice weekly resistance training. And with this study, they used FES, electrical stimulation, as their form of resistance training. Now, this study was successful because the exercise was associated with local increases in muscle mass in the leg and local decreases in intramuscular fat in the leg, but it wasn't a low-calorie diet. And there was not an overall decrease in weight or fat mass. So it's still, from this study alone, it's difficult to conclude, if this really was a low-calorie diet and there was weight loss, would the FES have been sufficient to maintain lean mass? And so we really, again, can't draw firm conclusions, unfortunately, from this study either. There was one study now that looked at something else that I want to talk about outside of high protein and resistance training. In this study, they combined diet with testosterone replacement. And we know that after spinal cord injury, there does tend to be a real significant drop in testosterone. So this was just a case study with one 30-year-old, 1-year-old man with paraplegia. It was a 16-week study where they gave this gentleman testosterone at 4 milligrams per day and put him on a low-calorie diet by reducing his calories by about 445 calories per day, as well as increasing his protein to about 28% of his diet. This study was interesting. They did find decreases in body weight and decreases in fat mass, as well as visceral fat, which is highly encouraging. And lean mass actually increased in this gentleman by about 3.1 kilograms. This is highly encouraging, showing that we can get high quality weight loss by possibly pairing low calorie diets with testosterone replacement. Now, this is just a case study of one. So again, a lot more research has to be done on, who may be suitable for this kind of intervention. But it is some of the stronger evidence that this is possible after spinal cord injury. So what's the importance of high quality weight loss? Why is it so important to try to maintain lean mass while we will lose weight, especially after spinal cord injury? Well, one, we want to maintain any lean mass we have because it's going to equal increased strength and increased independence and function, especially for people with incomplete spinal cord injury that have some function to begin with. It's also, as Joanne mentioned, any muscle mass that we maintain during weight loss is going to help to maintain or increase our basal metabolic rate so that, we can even burn more calories at rest. So it's very important to maintain lean mass for that reason. Maintaining our lean mass is going to reduce our risk of things like type 2 diabetes, because muscle mass is exactly where we store glucose. So we really can't afford to lose muscle mass for that reason. And it's becoming more and more appreciated that muscle is very, very important because muscle actually acts as an endocrine organ itself. That means muscle itself can release different substances into circulation that can themselves be very, very healthy. And it's been shown that muscle can release what we call myokines into circulation. And those myokines can crosstalk with adipose tissue and fat to help improve overall health. So this is becoming more and more appreciated. Myokines are cytokines that are secreted by muscle during exercise, and sometimes in an intensity-dependent fashion. And like I said, they can communicate with fat and bone tissue as well. Two that are becoming more commonly appreciated, one is called irisin. And irisin is a myokine that gets released from the muscle, and it promotes browning of white adipose tissue. So we have 2 different kinds of fat. We have white fat and we have brown fat. White fat is not metabolically active and brown fat is. And the more brown fat that we have, the better our metabolism is going to be, and the better we are going to be at weight maintenance as well. And this myokine irisin has been shown to actually kind of help convert that white fat into brown fat, and it's been shown to be anti-inflammatory in rat models of spinal cord injury as well. There's another BAIBA is another myokine. And again, it's been shown to kind of promote this browning of white adipose tissue. And it has also been shown to have an anti-inflammatory effect as well. So here's just more evidence of why muscle is so important, not just because it, maintains our strength and independence, not only because it increases our basal metabolic rate and reduces the risk of type 2 diabetes, but it may really have the ability to release these myokines, which has an effect on fat tissue as well. So high quality weight loss, can it be achieved after spinal cord injury? It's really a topic that warrants a lot more investigation. It's certainly tricky. It does look, I think, to be possible, but really with being very careful about pairing our low calorie diets with both resistance training and high protein. And again, time will tell if testosterone treatment can play an important role in that as well. So to that, I'm going to pass it back to Joanne, and she's going to go through a client case.
Okay, thank you, Dave. So just to give you guys an example of eating in the pattern that Dave and I have been talking about, what it can do, like just kind of hard facts. With one particular client that I worked with several years ago, he was a 50-year-old C5, 6, 7 incomplete quadriplegic. At 3 years post-injury, he came to me because he had gained 40 pounds in those 3 years and had developed a significant pressure sore on his coccyx, which I was talking about. It's one of the things that can happen with weight gain, one of the side effects when you're sitting in a chair long-term. So I put him on this anti-inflammatory diet that we've been talking about, with 1 serving of low glycemic fruit, 5 or more servings of vegetables and protein for breakfast, lunch, and dinner, 1 serving of grain, a couple servings of legumes. And this was a dramatic result with this particular fellow. In 20 weeks, so a very short period of time, he lost 40 pounds, which was incredible. Now, this was also in conjunction with 5 days a week. He was doing 2-hour workouts on an arm bike and body weight support treadmill. Now this is what's interesting, is he was doing these 2-hour workouts 5 days a week prior to starting the weight loss program. So he was working out, the weight wasn't coming off. He went on this anti-inflammatory diet, and very quickly he lost 40 pounds. So it was incredible to see that. And then, the benefits he also experienced were increased energy levels, improved self-esteem. So this kind of diet, it can work effectively, high quality weight loss, and quickly in some people, not everyone. This was quite dramatic, but it is remarkable what an anti-inflammatory diet can do. And one of the other things that I didn't mention is, we keep talking about anti-inflammatory diet, is because we are chronically systemically inflamed post-injury because of medications, because of stress, because of infections. One of the things that, junk foods and sugar and fast foods can do is increase our stress hormones, things like cortisol. And when cortisol is up, then what that actually does, cortisol is a hormone that instructs your body to hang on to the calories you consume and actually store them, pack them in your abdominal region. So that's another reason why when you're eating junk foods and sugar and things, and you're having a huge inflammatory effect on top of a systemic inflammatory state, it packs that weight on. Anti-inflammatory diet, it really does. And it's amazing, like a domino effect. The benefits, the weight comes off, the pain comes down, mood goes up, as Dave was saying about depression. So it is remarkable what I see in a weekly basis with the clients that I work with and that Dave works with in his university and the studies that he does. It really does impact your entire quality of life. So highly recommend it.
So thank you very much. That kind of concludes our talk. I'm going to have to run out. Joanne knows that she's going to field the Q&A period until I get back, but
Sounds good.
Thanks so much, David.
Thank
We are opening the Q&A, and we have a couple of questions already in the chat. And I know
Sure.
I have a couple, but let's start with Alan's question. Is there a risk in how quickly we lose the weight? Roy Orbison died of a heart disease brought on by rapid weight loss before concert tours. I'm scheduled for lumbar spine surgery in the near future. I don't know when. Is there a risk in dieting before surgery?
I would say absolutely. It's a great question, and be careful, because our chairs are all custom, and our seating, whether it's our backrest, our cushions, to our weight at the time we've had these equipment, developed and designed for us, custom made. If you lose weight too quickly, you're going to shift your pressure points. And I have certainly seen people develop pressure sores after dramatic weight loss. So I always advise, and if I see people losing weight rapidly, then I will advise to check with their seating clinic, their OT, or whoever, PT, OT, and monitor, do skin checks, and make sure you're not going to develop a pressure sore, because it can definitely happen. And there's no guarantee on where you're going to, shift that weight when you start losing it. So you've got to be really hyper vigilant, and, check your back, check your butt, check everywhere for pressure sores, because it absolutely can happen, especially with rapid weight loss.
Mm-hmm. Another question from Alan. Coffee, is decaffeinated coffee okay, or no coffee at all?
No, it's limited. Like I'm a coffee lover, and I certainly have coffee every day. It's what you put in the coffee that can really be detrimental. So, if you can have black organic coffee, great, or just black coffee, fantastic. It's when you start putting the processed refined sugar in there, and the flavors, people add to it. That's when you get artificial flavors, artificial colors, and the sugar. That's when the inflammatory effect starts to come in. So have 1-2 max coffees a day. Try and drink them black without any kind of sugar in there. And if you want to have them decaf, sure, absolutely. But again, try and stick to only 2 a day. When you have more than that, caffeine does raise your adrenaline and your cortisol. And I was saying before, cortisol is a stress hormone. And if you have too much of it, it actually instructs your body as a hormone to store weight in your abdominal region. I work with people sometimes, and when they first come to me, they're drinking 6 to 12 cups of coffee a day. First thing I do is try and get them down to 2. And I have a woman just recently who was drinking regularly 5-6 cups of coffee a day with 3 sugars in each one. And she was amazing. Cold turkey, went down to 2 cups, no sugar. And with all the other things we talked about, she's lost over 50 pounds now. Wow. So if you do like your coffee, it's no more than 2 a day, and just watch what you put in them, please.
I have a follow-up question that I noted during your talk. Is there a healthier or less bad way to sweeten your coffee if you can't tolerate it black?
How to sweeten it? If you like stevia, which is a plant, it's 200 times sweeter than sugar, and you can get it in powder or liquid form, and you can put a little drop of that in your coffee. That's what I would say. Try and do stevia.
So like a more natural sweetener that's not sugar, it was okay to try.
Yeah, try and do stevia. Don't do the artificial ones. Like, try and stay away from the aspartame stuff, because that again can be inflammatory. Okay. Try and stick to stevia. It's a plant.
Gord, you have a question.
And what a lot of information to digest. I'm really looking forward to the video coming out, because I've been trying to take notes mentally. I live in a long-term care, and trying to get a diet is really, really difficult. I mean, they've got 215 residents in this unit, in this residence, and they've got 16 residences around Vancouver Island. So to try to get them to change one person's diet is almost nil to non-existent. Is there anything that they can perhaps peruse in order to get an idea of what they need to do in order to reduce a lot of our weight gains. I mean, I'm not the only one. I'm probably one of 4 with SCI, but I noticed that a lot of them with MS and things like that, they're just as likely to gain weight as I am with SCI. So.
I did write a book, came out probably about 8 or 9 years ago. It's on PDF form. You can get it, Eat Well, Live Well with SCI.com. And that actually has various chapters. And there is a weight loss chapter in there for guidelines about what to do. So that could be something if you want to help instruct the facility that you're at, or some of the other facilities that you're mentioning. So there are, there's a guideline there in the book, but, and for yourself, or even some of the residents that are there, even if you just kind of self-monitor, like whatever's being offered for breakfast, if you can select protein, if there's eggs in the menu or yogurt, have that every day versus cereal or oatmeal or toast or bagels. And for lunch and dinner, if there is rice, pasta, just skip it and try and have any kind of meat and vegetable. Skip the desserts and skip the bread basket if there is one. If you do have a sandwich, just make it a 1 slice sandwich. And there's just ways to kind of cut corners and curb what is actually being offered. So those are some of the suggestions, because often it's not, when I'm working with individuals, it's definitely what you add to your diet, but it's often what you take away that can also make the biggest difference. So by taking away the cereal for breakfast, by taking away like the rice and the pasta, you can also get a lot of benefit from. And I mean, I totally understand the situation that you're talking about. So there are guidelines out there if you can maybe kind of steer the facility that way, or just for yourself. Like I said, if you can kind of tweak what you are consuming every day in the residence that you're living in, that could be a way.
Is cooked vegetables as better than non-cooked, or like
you're still going to get nutrients from it, and because people with SCI have decreased and compromised digestive function, a lot of people have a hard time with raw vegetables. So having them cooked is easier on your gut, it's easier on the system. Have them cooked, and if you enjoy them that way, fantastic. If you can eat raw vegetables and there's no digestive upset with bloating or anything, then go for it. But to me, as long as you can get the vegetables in there, whether they're cooked or raw, is better than not having them at all. So I would say however you can enjoy them and you best tolerate them, have them that way. Yeah.
Thank you.
You're welcome.
Next question.
I also live in complex care. Fortunately, the dietitian here is really big on custom diets. We have 118 people. And, I've been very, very fortunate here. I have a few questions about the blood, about the nutrients in your blood and that kind of thing. Can you get a blood test for a baseline to figure out where to start?
You can get a baseline. Like when you go to your regular, GP, they always do check for iron, for B12, right. Vitamin D, if they can check that box. We definitely have to pay for it out here in Ontario. So you can get those ones checked for your regular blood work. The ones that the list I had, those were specific studies that were done. And so they were looking like for all vitamins, all minerals. So it wasn't necessarily a standard blood work that you would go to your GP to get, but you can definitely get your iron, your B12, and your vitamin D checked. And then as far as other ways to monitor your intake of those nutrients, even if you get there's certain diet, apps out there, Fitbits and things like that, where you punch in what you eat every single day and you can get analysis done on what your intake of vitamin A and all the different Bs and what that are. So there's different ways. You can either go online, monitor your own diet and punch it in, And after a couple of days or a couple of weeks, see what your average intake is of all those vitamins and minerals, or get a couple of them checked through your blood work at your physicians.
I find
question.
I find I write my meal, like everything I eat in a day, down because it keeps you more accountable.
Absolutely.
In my mind. The other thing I want to know, does insulin dependence, does that cause weight gain?
Does insulin dependence? So
like I'm on insulin every day. Yeah.
Yeah. It's very different. It's individual. So I don't want to make a blanket statement because I've seen to have different reactions, different people. Yeah.
And then my last question is about bloating. I'm constantly bloated. I eat a very high fiber diet. Okay. And I don't know, it's just, as I'm getting older, it's getting worse.
And it does. So as we get older, our stomach acid production decreases. The effectiveness and efficiency of our digestive enzymes isn't as great, which is why, when you hit your mid-30s and above, you start to have digestive issues. And then you add on top of that a spinal cord injury where, our digestion is compromised as well. So you do start to have changes in your digestion and bowel function with years since injury. So I would be really, if you're already recording what you're eating, just be really very, very conscientious of what fiber foods cause bloating more than others. And you might want to cut out some of the ones that are causing more bloating, but also, I don't know, like probiotics, supplements can help decrease bloating. Ginger is amazing to help. Ginger tea, fresh ginger root tea, just get a chunk of ginger and a hot cup of water and drink that. It can help decrease some of the bloating as well. Yeah. Again, everybody's different with what causes them, bloating, but I would just really record when you get really bad bloating and what you've eaten in the meal just prior to that. And it might still be a healthy food, but maybe it's just the way your body's reacting to it. And if you can alter, some of your diet according to what's causing you more bloating than others.
We found that beef was one that really caused bloating.
Okay, so it's protein.
Yep.
Okay, so if that's the case, what you might want to do is take a digestive enzyme. Okay. So our pancreas produces enzymes to break down carbs, fats, and proteins. Again, as we get older, they just, we don't produce as many, our system is less effective. So what they do is there's actual supplements called digestive enzymes. Foods like papaya and pineapple have natural fruit enzymes in them. They isolate them. And if you take one or two of those when you eat, say, a high protein meal, beef, with your dinner or your lunch when you're having the beef, it can actually help break down that protein and aid your body in breaking down the protein and absorbing those nutrients. So you've already identified what causes you more bloating. I would go to your health food store and get some digestive enzymes, take one or two with each beef meal, see if that helps. You make a big difference.
Thank you.
Okay.
I just want to get one more question in before we start the next session. And Jim, I believe you're next. If you could just keep it brief. Thanks.
Okay. I 6 years ago had a major inflammation in my neck. Quite extensive MRI shut me down from C5 to T2. Was in the hospital at VGH eventually, was used as a teaching case there, presented in front of a group of 30 people in the neurology department, and I asked a question about inflammation, and I got shut down as quickly as I could be shut down and wheeled out of the room. Laughter by some of the young students who could see where I was going, obvious discomfort by the established neurology. Then I went to GF Strong in the rehab hospital and tried to talk about anti-inflammatory diet, found very limited support there. And now I'm in the home front for 6 years, and I seem to know more about inflammation than any of my physicians. Why the block?
Great question. I've actually never heard such a block like that. And I'm sorry you went through that. I don't know, because the research studies are out there. Dave Ditor, who just spoke, that's his specialty. And he has had many published studies in journals, neurological journals. about inflammation is what he studies. So I don't know why that would be. The studies show we are systemically inflamed because of a number of factors, and it has a detrimental effect on numerous aspects of our health. I don't know, the information's out there, and it's not just, as Dave said, it's not hearsay. There's scientific fact to see it. You see it in the blood, the cytokines, which are inflammatory markers. I don't know. I really don't know why that would be.
I could see, slow to trickle down to the GPs, but I, asked the neurology department at VGH. I've got obvious inflammation. Why am I not on a non-inflammatory diet? And I was wheeled out the room.
I am so sorry to hear that, because the research is out there.
Yeah, thank you.
I don't know why there would be that block, and I've never heard it to that extent.
Yeah. 6 years.
So hopefully things will change.
Thanks, Jim. We're gonna wrap up and move on because our next speaker's in the room. But just for anyone who has more questions, especially questions you might have for Dr. Ditor, we'll make sure to collect those and see if we can put out some answers to questions if necessary. Feel free to email us as well if you have questions you want us to put to anyone here.